Nice, deep breath in, and on the way out. Nice, Josie, stay there. Nice, Josie, okay, stay there. Hi, this is Dr. Kennedi Pierce at Advanced Health Chiropractic. I have Josie here with me today. Josie's just going to tell you a little bit about why she's coming into the clinic and how everything has been going for so far.
Hi everyone, my name is Josie. I came in with full spine pain, numbness down my legs, neck pain, and Dr. Kennedi and the rest of the awesome team here has greatly helped me improve through adjustments, traction, and rehab.
Okay, so thank you, Josie. Now we're going to get Josie adjusted, and I'm going to walk you through her soft tissue as well. So, Josie, go ahead and go face down for me. We're going to start with flexion distraction. So I'm going to go ahead and strap in Josie's ankles. Nope. All right, now we're going to go straight into some press-ups. We're going to do 10, Josie.
And then I'm going to raise up as high as I can. Hold it for 1 second. Bring it back down. Raise it as high as I can. Hold it for 1 second. Bring it down. I notice as I'm doing that, I'm having like control.
One more. Okay, go ahead and relax for me, Josie. All right, now we're gonna use the ArthroStim, stimulate the spine to get it prepared for the adjustment. Okay, we're gonna start with the activator on Josie's cervical spine. Okay, and now we're going to Josie's thoracic spine, looking for those subluxations and fixations. Deep breath in for me, Josie. Breathe all the way out. Nice, deep breath in, and on the way out. In, out. Okay, now down to the lumbar spine and the SI joints. Josie, I'm going to bend the knees. Couple drops to the hip. All right, Josie, face me on your side this way.
On your way.
Deep breath in. And out. Nice, Josie, stay there. And we're gonna work on some soft tissue, targeting the left sciatic nerve. So, I'm gonna pin it. Josie, up. Kick. Good. One more, Josie. Good job. Okay, face me this way. Deep breath in. And all the way out. Nice, Josie. Okay, stay there. And now the sciatic nerve on the right side. Straighten.
You're going to find a distance between your foot and the wall where A, you can touch your knee to the wall without your heel coming up.
One more.
Teaching and challenge. So you do this, it's not hard.
Nice. And then we'll do the psoas after the video. Okay.
That's fine.
All right, so now come on up.
I can do that.
Thank you.
Passion test. Civilization, baby. You got it.
Microphone's getting closer to us.
Just hit it. Just hit it.
I should. All right, same thing on the other side, Josie.
I'll find out the reasons on that. Yeah, obviously he's got this guy adjusted.
There we go,
All
Josie.
supposed to do a video.
You're doing it really hard.
Oh, okay. I'll line up. Hold on. Is this better?
Yes.
Okay.
Try not to talk.
Chin and arm.
You want to tell.
No, you're doing well.
That's what we got live.
Wait. It was more tender on this side, wasn't it?
Yeah.
Do you want to do your rehab
Okay.
and traction?
If you're experiencing any similar pains as Josie, schedule a new patient appointment online. If you have any questions, call the number online as well. And if you're on YouTube, like and subscribe to our channel. We'll see you in the next one.